dentistry is basically allowing us to use current technologies where we use computers to assist us to do different aspects of dentistry, whether it's in diagnosis, such as doing diagnostic radiographs that we do digitally. The nice thing about that is it's immediate. You know, we have the results right away. We can see immediately whether or not we need to get a different angle, so we don't have the patient waiting for the films to get developed and find out, oh, I need to come have you and get another image of this. We don't have the nasty chemicals that you have when you have to develop film that we then have to somehow get rid of in our environment, and we're trying to stay much greener with what we're doing to earth. You know, we don't have that to deal with. And also we have the ability to really limit the radiation to patients versus the old method. And so it's up to 60 to 90% less radiation to our patients when we use digital radiographs. So, and I like them because I have a lot of ways that I can manipulate the images to be able to see the things I need to see and make the proper diagnosis. Another type of technology that we use that is basically computer assisted is Diagnodent, and what that is a type of non-cutting laser that we can use and shine the light into the deep grooves of the teeth and help us determine whether something that is just a stain, is that really a cavity or just a stain? And quite often that's one of the most difficult things for dentists to determine. So we found with Diagnodent, and studies show that it's 75% more successful in accurately diagnosing decay and grooves of the teeth, more so than just looking at the tooth or the old explorer stick method in the grooves of the teeth that most patients hate. But what this will allow us to do is catch decay at an earlier rate, that we can keep that filling as small as possible, and over the lifetime of that tooth, keep that tooth stronger. The last area that we use a lot of, or the last couple areas, is that there's lasers that we can use to help us create access to getting say a restoration made and there's too much bleeding or something. We can actually use a laser to help stop the bleeding. We can use a laser to help create contours of gum tissue sometimes for a better aesthetic result. We can use lasers sometimes of where you have a bad sore, like an aphthous ulcer or a canker sore that's very painful, and you can just touch that with the laser, and that can make that area heal quicker with much less pain. That's something that can be done as well. And then the last thing is that we have the ability to actually create crowns that a patient can have and take home as a permanent restoration the same day. So those are some of the different types of technologies that we have available. And that's what people talk about when they talk about digital dentistry. I think there's probably the myth out there that if you have a lot of digital dentistry, that my dentistry is going to cost more. And that's not necessarily true, because we're able to save the patient time. They're not missing work, like for example the crown in the same day, as well as we're able to do a much better job with it, that maybe they're not remakes or things like that. The materials, sometimes we can actually, using digital dentistry, we can keep some of our costs down. Yeah, it's an initial investment, but it's the best thing for our patients, and so it's worth the investment. But I don't think it has changed for the 20 years that I've been doing dentistry. I don't feel like my dentistry costs any more or less whether I use digital dentistry or not.